Yes, Mr. Chair, we do.
Okay, call the meeting to order at 6 o'clock. We have quorum. So looking at the agenda, the first thing I need is a mover and a seconder for the agenda. Moved by Councillor McLaren, second by Councillor Chappelle. There's only one item on the agenda. Is there anything to say about the agenda? This is your chance. All right, we'll approve the agenda. All those in favor? And that carries. Disclosure of pecuniary interest.
Sorry, Mr. Chair, before we move on to disclosure of pecuniary interest, there are a set of minutes to approve.
That's right, this is the regular meeting. So we need the minutes from last meeting, moved by a member that was present, Councillor McLaren, seconded by Councillor Kiley. Any comments, errors, omissions, additions to the minutes? Seeing none, we'll approve the minutes. All those in favor? All those opposed? And that carries. Now it's disclosure of pecuniary interest. Seeing none. I'm trying to do this without toggling back and forth, but what's the next item, Madam Chair?
The next item, Mr. Chair, is delegations, but we do not have any delegations, and we also do not have any briefings this evening.
Thank you. So that brings us to business. The item of business is the report from our long-term care home, Rideau Crest. So we need a mover and a seconder to resolve into the Board of Management for Rideau Crest. Moved by Councillor Kiley, second by Councillor Chappelle. All those in favor? Opposed, and that carries. We're now the Board of Management. I see we have our administrator here present, and I believe, Madam Clerk, we can go to Ms. Keys for an introduction of the report.
That is correct, Mr. Chair.
Go ahead, Ms. Keys.
Thank you. Good evening. This is the fifth and final report provided to the Rideau Crest Board of Management for the 2020 year. This report contains information from November through till the end of December. Rideau Crest Home had 3 incidents reportable to the Ministry of Health and Long-Term Care and no complaints during this time. As well, the ministry was not in the home during this reporting period. As of December, there were 502 people on our wait list for the home. 266 of those are waiting or actively seeking and requiring admission to long-term care, of which 85 are in crisis awaiting placement. There was a respiratory outbreak declared in the home by Kingston KFL&A Public Health Unit on November 9th with an isolation of both rhinovirus and enterovirus. There were 15 residents and no staff affected by this outbreak. There were no hospitalizations or deaths as a result, and this was declared over on the 17th of November. Rideau Crest continues to work very closely with the Ministry of Health and Long-Term Care, our local health integration network, and our local public health unit to ensure the safety and security of our residents and staff as it relates to the COVID-19 pandemic. To date, the home has not reported any positive cases of the virus. Rideau Crest continues to complete home-wide swabbing of all staff as mandated by the ministry in accordance with provincial timelines in an effort to detect asymptomatic cases. The province is currently working to introduce rapid antigen testing to all long-term care homes. This testing is intended to be a supplemental screening tool that homes are to utilize for all individuals coming into the long-term care homes. The frequency with this form of testing is drastically increased to 2 to 3 times per week per individual. The home continues to learn more about the rapid antigen testing and is creating initial plans for implementation. The home has finalized its COVID-19 staffing response plan in the event we are required to declare an outbreak and find our home in a staffing shortage. This plan offers strategies for redeployment of Rideau Crest employees, City of Kingston employees, and volunteers within our community. To date, the home has 43 employees from across the corporation signed up and educated on the home's orientation and education package. These employees will be called upon if required to ensure our ability to care for our residents in the event of an outbreak. Excuse me. The home has begun the rollout of COVID-19 vaccine. To date, all of our consented residents have been vaccinated and 50 employees have received their initial dose of the vaccine. Due to distribution concerns of the vaccine, the province has reprioritized to allow all long-term care residents to receive both doses prior to then committing to any further staffing and essential caregiver vaccinations. As of the end of October, the home has received $415,000 in emergency COVID-19 funding. This funding supports the cost of supplies, screening costs, and other incremental pandemic expenses. As of year end, costs associated with this funding are $70,000 greater than the funding provided. The home is required to submit a final expense report in January, and it is not yet clear if we will be reimbursed for that overspend. The previous funding stream report was from April till June, and we did see additional funding for that overspend at that time. As we continue to finalize our year-end financials, we are estimating that the home will be 2.5% underspent for the year 2020. While presenting the provincial budget in October, the Minister of Long-Term Care made an announcement that the Government of Ontario will be implementing a 4-year staffing plan for long-term care homes, which will see a gradual increase in direct care staff over the course of the next 4 years, with a goal of 4 hours of resident care per resident per day. This plan sees the province making a $1.9 billion investment annually by year 2024 to 2025. In December, the province released the Ontario's Long-Term Care Staffing Plan, which provided some insight into this initiative. To date, there is still very little information on implementation and/or funding models to help support this plan. We are expected to receive further information in the first quarter of this year. The home, in conjunction with Facilities Management and Construction Services, as well as our corporate partnership and grant development analyst, applied for provincial grant monies to help support capital renovation plans for our resident tub and shower rooms, our staff locker rooms, elevator replacement, and 5 resident washrooms. This grant is to be awarded in April of this year, with work to be completed by the end of the year. Work has also begun to plan and prepare for these projects if we are successful in the application. The home is also continuing work with Facilities Management on the flooring replacement and capital plans to expand all of our common areas and dining rooms on the terraces for the year 2021. And I'm happy to answer any questions.
Thank you, Ms. Keys. Sorry, I'm just trying to figure out how to get this back. There we go. Yes, well, I'll start off with the question about the vaccination. So from your report and your explanation, the coming from the province and the limited number of available vaccine, the staff that have already had the first dose won't get the second dose at the 30-day point or the 28-day point as scheduled, it looks like at this point. Have we been told anything from public health about what that does to your immunity?
So we have, with the 50 individuals, staff members that have been vaccinated with their first dose, they did, upon receiving that dose, get their appointment for the 28-day time period. Those have all been pushed out to 42 days. We are told by public health that the 42-day window does not have impact on the vaccine and its effectiveness. So at this time, we are seeing bookings come through for those staff members to receive that dose. It is intended, as I said, that residents receive both of their doses. Those staff that have had their initial dose do get that second dose before that 42-day window. And then we will be moving into identifying those staff members that have yet to be vaccinated and then moving towards essential caregivers.
Right. It's thank you. That it is concerning that that the vaccine is not being distributed as quickly as some people would hope, but at least the residents are at the front of the line and they're the most vulnerable. So that's good to hear. Are there any other questions from members of the committee? Councillor Kennedy.
Thank you, Mr. Chair. Through you, Ms. Keys. Today, I see numbers from the province concerning the B117 variant, and the high projections are frankly horrifying. It's something like 20,000 new cases a day. I'm wondering if the home has any plans to do additional measures to prevent against the variant particularly.
Yes, the numbers and the cases that we're seeing as a result of the variant are extremely concerning and actually really quite devastating. We have seen the variant within some long-term care homes, and the rate at which it is being transmitted amongst the residents is extremely fast. So as a result of that, there's a lot of people getting sick very quickly, and as a result, unfortunately dying from this variant. Public health is telling us that there's no further measures at this time that need to be taken as outside of what we currently have in place. So the screening protocols remain the same. The masking and face shield coverings, as well as PPE requirements, are all in place and will remain in place as we understand it for much of 2021.
All right, and I just presume, but for diligence, I'll ask, everything that you do is being guided by direct contact with public health?
Yes, absolutely. Yeah, we're in contact with public health on a weekly basis, and we are following both their directives and mandates as well as what is coming out from the province.
Thank you very much. Keep up the good work.
Thank you.
Any other questions from members of the committee? Actually, I have another question about the rapid antigen testing. Is this like something that is tested from your breathing, or is it a blood test? Or can you tell us a little bit more about this?
Absolutely. So the rapid antigen testing remains at this time to be a nasal swab test. So what we're looking to do and what long-term care is looking to implement is you do get the results of this test within 15 to 20 minutes. So it's looking to identify those positive cases prior to them seeing interaction with the residents. We will be, and it's preliminary at this point, but all caregivers and contracted services, individuals coming into the home, will be tested. We will await their results prior to them going to either visit and or do work on the units. When it comes to staff, it is a tool that we will be using for 2 to 3 times a week. When they come in for their shift, they will be tested at that time. And again, it's trying to identify a bit sooner those positive cases from asymptomatic individuals.
So the protocol, if a staff member, God forbid, should test positive, you'll know almost immediately, but not immediately, within 20 minutes, if it's working properly. What is the protocol for what happens in the event that a staff member tests positive from the rapid antigen testing? What happens at that point?
So as soon as we're made aware through the rapid testing that there is a positive case, it's identified, that individual is removed from the home and is sent to the testing center to have a nasopharyngeal swab to confirm that the test is in fact positive with that swab.
So it's my understanding that it can sometimes detect the antigen in a case of someone who's not actually carrying coronavirus. So if that is, but they would be, if they go to get the regular COVID swab at the center, the protocol is that you self-isolate until that result, which is at this point around 24 hours. So that would mean that they would be not able to work for that, at least the 24-hour period, regardless of what the result of that second swab is, correct? So would that leave you in a staffing shortage if this rapid antigen testing starts showing some of these sort of minor positives that don't actually indicate infection?
Yes, so we are being told by public health, it was a concern that was raised by homes that there is an increased false positive from the rapid antigen testing. The province is quite confident in this testing and doesn't feel as though it is yielding many false positives. In the event that we do see one, yes, it is expected that individual is tested and is isolated until they get their nasopharyngeal swab from the assessment center results back, and that they are negative and safe to enter into the community and of course long-term care. So that is what we're seeing at this point. It is and could have negative impacts to our staffing levels. I don't know if it's going to be any more than we're seeing now. We are seeing challenges with anybody who is having any symptoms of COVID-19 are not allowed to come into the home. They are then sent for a COVID swab and do have to stay at home until that swab is returned negative. So we're seeing a lot of that happen now. Unless we're seeing an increase, a significant increase in false positives, then we're hoping and not expecting to see much more absence that we see now.
Right. So on that, sorry, one more follow-up. So on that staffing issue, from the point of view of the human resources, so you've just identified a higher rate of that situation happening just because of the pandemic. Are those staffing resources that you have with the additional measures taken, would you say they're adequate for keeping staffing at 100% throughout the pandemic?
We have definitely had and seen staffing struggles through the course of the pandemic, and there's a number of factors that have played into that. One is definitely the screening tools. As any symptoms related to COVID, staff are not allowed into the building. They then, as I said, are sent for testing and are at home for what we're seeing up to 48 hours until they're seeing those results come back. So it is a couple of days out of the home. That's a challenge for us and has remained a challenge for us. The single site directive that has come from the province indicating that you can only work in one healthcare facility. We've seen challenges with that as well, straight from the beginning of the pandemic. And then as over the course of the last year, as we've seen turnover in staff, it's been very difficult to recruit further staff because it's normally part-time positions, and most of the individuals applying are already carrying a part-time job at another healthcare facility and may not be aware of the single site directive. So that has also been a bit of a challenge for us in terms of staffing.
You brought up another topic, which I don't want to really go into here, but that is the current preponderance of part-time positions, and not just here at home, but province-wide, which was in direct conflict with that directive that you just mentioned and caused a staffing shortage. I would suggest the ministry has to really think about that, and they may need to mandate full-time positions or something to avoid that happening in the future, because there doesn't seem to be any other solution. But that's something above both of our heads, and thank you for identifying that. I'll go back to members of the committee if there are any questions. Councillor McLaren.
Thank you. I read 50 of the employees had already received the vaccine at the time of writing. Have all of them received the vaccine now, or is there anybody who's still lacking?
So we still to date only have 50 employees that have received the vaccine. There was only a very limited amount of clinics that were opened up prior to the distribution concerns that have taken place and the shortages that have taken place in regards to the vaccine. So there has not been any further clinics opened up to long-term care home staff at this point. We are expecting over the course of the next few weeks for that to change as the residents do get their second dose, and we see some of those shortages and or vaccine distribution concerns hopefully rectified in the next few weeks and coming months.
May I ask, have there been any adverse effects from the vaccination?
With staff and residents at this home, we have not seen any adverse effects to date outside of the sore arm and maybe a little bit tired after your vaccine. Those are really the limited effects that we've seen from anybody that has had the vaccine for this home yet.
Wonderful. Thank you.
Any other members of the board? Yes, Councillor Chappelle.
Sorry, the unmute button keeps moving around on me. Thank you, Mr. Chair. One of the comments from that time period up to December 31st were there no written complaints. And I'm wondering about family members who have, what do you call that? When it's the end of life, there's a term for it. There's an agreement that you sign over your medication and I can't remember the name of it, the term. Power of attorney. So with the power of attorney, are we doing a job? Are we notifying residents who have power of attorneys to the people who are responsible to them if we're changing the medication of the patients that we're taking care of in Rideau Crest? And what is the protocol we use in order to do that?
Yes, absolutely. So our policy at this time is any medication change that takes place for a resident and or a new order that takes place, the power of attorney is notified of that and made aware of that. So we are in constant communication with our powers of attorney any changes that take place in terms of care requirements for our residents.
Okay. And I'd like to say I'm really pleased to hear that we have not had an outbreak, and that I'm saddened to learn how many patients there are in the community that are in desperate need of their services. And do you have any insight on what can be done for the long waiting list of critical care patients, or is it just the demographics? Is there anything from your perspective that you're doing a long-term forecasting and planning and to address this?
So I must say that the waiting list as it stands today is the highest that I've seen it in the last 7 years that I've been here. And again, COVID has not helped with that. As we've moved through this pandemic, there was a significant amount of time where there was no admissions to long-term care. So those individuals that were requiring and or seeking long-term care, that list was building up. They were either sitting in hospital and or sitting at home. And over that course of that time, some of these people have come into crisis and are not able to be at home anymore. And we're now seeing them moving into hospitals, plugging up those beds that could be required for more acute issues. It's a challenge in long-term care. Wait lists across the entire province are very high. I'm not sure what the province is going to do in terms of licensing for new beds. There are rebuilds taking place across the province of long-term care homes. As a result of some of those rebuilds, we are seeing operators and licensees that are requesting more beds to be added to their homes. And the province is willing to do that. I think that needs to continue to take place as more and more rebuilds and or retrofits are happening to long-term care homes across the province.
Okay, thank you.
Thank you. Any other questions from members of the committee? Okay, well, I'll just like to add my voice, Ms. Keys, to those in support of your difficult work during the pandemic, and fingers crossed that the 117 variant doesn't throw us into the deep end here, and hope that we all can get through this. And thank you for all your efforts.
Thank you.
So now I guess that's the entirety of that business item. So we need a motion to rise from Board of Management. Councillor McLaren and Councillor Kiley, all those in favor? And that carries. So we're done with the Rideau Crest Board of Management, and we're back to the committee. Madam Clerk, are there any other items of business?
No, Mr. Chair, there are not.
Okay, is there any other business from members of the committee? Seeing none. We have our next meeting. So this was our regular meeting, and just to clarify, in case you were wondering, I think this question was asked at our special meeting on Monday. There was no way to procedurally combine the two meetings, even though there was only one item on this meeting, because the Rideau Crest Board item is provincially mandated, and it comes to the regular meeting, and we can't change that. We can't move it around. It has to come at the regular meeting of the policy committee. So there'll be another one in our next meeting, which, going back to my agenda, I don't have it memorized. One sec. The next meeting of this committee is Thursday, April 8th, 6 p.m. So now I'm looking for a motion to adjourn. One sec, I can't see anyone yet. Man, it's really hard to toggle with just one computer. One sec, I can't see anything. There it is. Okay, pull up your hands. You all have your hand up to adjourn. So we'll take this roster off. Councillor McLaren. All those in favor? This meeting's adjourned. Stay safe, folks.